Yeah, I am Dr. C.S. Hiremath, Senior Consultant and Head of the Department of Cardiac Surgery at Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield, Bangalore. I am also currently the Secretary of Indian Association of Cardiothoracic and Vascular Surgeons and also the past Executive Committee member of the Society of Heart Failure and Transplantation. Members of the society, what they are looking at is a very small incision. They are more going into cosmetology, where they look how fast we can get out of the hospital with a small incision, how we can cope up with our day-to-day activities. Of course, if you ask me, minimal access is not everybody's cup of tea. People do go ahead with minimal access. It requires certain expertise. It has its own learning curve. Well, in my practice, I practice both minimal access and the regular open access surgery. Of course, one should be aware that any surgeon who attempts a minimal access surgery has to have an adequate experience of open heart surgeries, then step into minimal access surgeries. Of late, not only in India but across the globe, people are going in for tissue valves. The advantage is, the first thing what members look at or the society looks at is of being free of anticoagulants. That's a challenge where the country is facing, and across the globe people are facing, with taking anticoagulants on regular basis, getting their PTINR blood tests done, which itself is a challenge. And in today's era, where valves have come into bioprosthetic valves, very good bioprosthetic valves we have in picture of various companies, and once that is implanted, as it degenerates a period of 10 years, 15 years or 20 years, the days will come to have a detailed idea on that. So we can always replace a valve in valve transcatheter technique, or we can always redo the valve and again reimplant a bioprosthetic valve. Ask, and it's the duty of a cardiac surgeon to explain that what valve we are implanting is not a permanent valve at all. It has got its own pros and cons, and definitely in India as of now, if a tissue valve degenerates, we have various options. One, replace the valve with another tissue valve, number one, or if the patient is young enough and does not want another second surgery, we can always think of a prosthetic valve, or if he doesn't want another surgery, he can always go for a transcatheter valve replacement, wherein they implant a valve through the transcatheter procedure, what we call it as valve in valve implantation. Today, India are the global leaders in heart diseases. By 2030, it is confirmed that they are the global leaders for world's heart diseases. And every minute, 4 Indians are dying because of heart diseases, whether from a newborn child to a grown-up adult. Not only this, every 100 children born, there at present the current, of these 100 children, if there are congenital heart diseases, only 20 children get treated with a proper surgery. The remaining 80 children just die like houseflies. Why? Either poor education, poor management, or being unaware of what exactly facilities are available at different institutes. That's where we are looking at. We also are part of the Indian Association of Cardiothoracic and Vascular Surgeons are making extensive efforts to see that how this can be stopped. Now, what I would recommend that we are cautious on our diet. Indian sedentary lifestyles, our diet factors are playing a vital role in the current scenario. So the gym starts in the kitchen. That's what I would look at. Be aware of what you are eating every day. Have a basic exercise. 5,000 steps a day is the minimum exercise. Be less than 5,000 steps, I call it as a sedentary lifestyle. You can walk anywhere you want, you can climb the stairs if you are fit enough, and have a regular checkup. In fact, after the age of 30, earlier it was 40, now the younger generation is affecting much. So every year, after the age of 30, have a regular checkup, consult your doctor. Everything should be done in moderate. And in fact, if you ask me, you can always fast also. Yeah, fasting also gives a huge impact on their health. A little add on to the spirituality. For example, a country like India, we are the global leaders in health. People, we set up examples for the world. Our culture, our systems will go back to our old cultures. Definitely, it makes a huge difference for your own living, for your own family. If you are healthy, your family is healthy, the state, the city, the nation becomes healthy, and definitely makes a huge impact